Hello dear friends, my name is Professor Alexander Turkevich, and today we will talk about something how we can inject face and return yes to the one's face. And we will talk today not about the things that we all know and they are not interesting at all. I mean doses, I mean the volume loss. We will talk about something new, about the games of shadows and lights, and about how to reposition the lights and shadow in the face, and how to inject with the help of PHILLEX to return yes to the face. I will show this with the help of our model. So, our model Nadia, 36 years old. Well, we all understand she is young enough, but anyway, even in that age of 36, she has slight signs of the age changes. What we can see, you can see the shadows that is here, and we understand the shadow is too low, and we need to put it up. What do we have to do? We have to bring some volume in the middle part of the mid-third. And one more thing, she has a little bit square face and she wants to be more harmonized, and what we can do, we can put some volume onto the skull bone, and if we will do her skulls more prominent, it will be much more beautiful, it will be much more harmonized, and she will look better. One more thing, what we have to do is to work with her chin. If we will put some volume in the lower part of the chin, we will make the face more harmonized, and even more. We can analyze in the profile, and when we will put that volume, we will make chin. We will elongate chin, and also we will make it a little bit more prominent. And we have one more thing. We have to analyze, as I have told, we have to analyze not just on face, but also profile. And in profile, we see some small, very light problems with the nose. It was not broken, but anyway, we have some deficit of the volume here and here, so we have replaced it, and when we will replace, her nose will be better. But even more, we will put some light volume in the middle part of the nose, so we will create like a small line. And due to the concept of light and shadows, if we will put some very thin volume here, we will make nose thinner, and it will be more harmonious to all the face. But doing all these injections, we have to remember our injections and the result have to be not just beautiful, have to be not just harmonized, but also it have to be safe, and all the injections have to be safe. This is the rule number one. Well, so friends, if we are talking about the safety of injections, we have to remember some things from the anatomy, and we have to understand very clearly which zones are dangerous, which are less dangerous, and let us repeat, well, in general, and something regarding those injections that we will do today. So in general, we have to remember that here in the area of glabella we have arteria supratrochlearis. It's very dangerous to inject this area with fillers, so with the years I just decided that I will not make injections in the area of glabella, I mean fillers, just toxins. And the next, little bit more lateral, there is arteria supraorbitalis. Sometimes we have to inject the lateral portion of the forehead, and when we are injecting, we have to remember about arteria supraorbitalis and about the collateral that is connecting arteria supraorbitalis and arteria temporalis superficialis. And working in this area, we have to be very careful not to damage those vessels. Going down, we have arteria infraorbitalis. We can check the place where it starts, because it starts together with vena and nerve infraorbitalis. We can press, our model tells us, yes, this is the place where I feel the light pain, and we know that this is the place where it starts and goes, and injecting in the middle part of the mid face, of the more medial part, we have just to go a little bit lateral, and the injections start to be much more safe. One more thing, we all are thinking that injections onto the skull bone, it's really safe, but not always, because sometimes every tense patient have the arteria transversa that is going not under the skull bone but on the skull bone, and it's going here. So we have to be aware that we're injecting in the safe way, and injecting in the safe way, we have to know where it is and do some very simple things, but I'll tell in a few seconds. And one more very dangerous artery, it's arteria facialis. It goes from here, and here it changed to arteria angularis, and after that arteria angularis is changed into arteria ophthalmica, the main arteria that is going to retina. And injection in all this area are dangerous due to the next. If we will make the injection into arteria facialis or arteria angularis, we can cause blindness. What to do, first of all, is to know the anatomy. As I have told, arteria supratrochlearis, arteria supraorbitalis, collateral artery that is connecting arteria supraorbitalis and arteria temporalis superficialis, arteria infraorbitalis, and arteria facialis that is changing to arteria angularis and to arteria ophthalmica. We have to know the anatomy, the placement of those vessels, and one more thing, it doesn't matter which area we are injecting, one of those dangerous, or we are somewhere near, below, or upper, doesn't matter where, we have to always make the aspiration test, the aspiration probe, and it have to be not less than 10 seconds length. We are making aspiration test at least 10 seconds, we know anatomy, and the risks of making injury during our injection go down 10 times. So, when we need to solve the problems with the volumes of the face, we are using HA fillers. One of those fillers are the line PHILLEX. This is PHILLEX fine lips that we can inject into delicate zones and lips. Next one is PHILLEX Deep Plus. We can create volumes and work with wrinkles, deep wrinkles. And last but not least, PHILLEX Sub-Q, which one I will use today. And it can be used for the creation and restoring of deep volumes. Here we have the syringe PHILLEX Sub-Q. What I want to show you how to open it. We don't need to move, we don't need to press. We just broken the upper part. It's very easy. And putting the needle. Here we have typical standard needle, 27 gauge. And with the help of PHILLEX Sub-Q, with the standard needle, we will make our first injection. The idea of the first injection is the restoring of the volume of the medial part of the middle third. So we are asking one more our patient when she feels pain. Or here is the place that is dangerous, so we will inject a little bit more lateral. We are injecting very deeply to the bone because our injection is supraperiosteal. And we are starting to make our aspiration probe. It was more than 10 seconds. And we are starting to inject. The volume that I have been placed is not too big for this area, 0.3 cc. Going out, and after that we are starting to make light massage with the help of surrounding tissues from down and from the sides. Next injection we can do with the bolus technique, or we can make them with the help of cannula. In this situation, our goal is not to create the big volume, but just to make the contouring. And the contouring with the help of cannula is more effective in this situation. What I want to mention especially for you, we don't do any anesthesia for this patient. And for reducing of the unpleasant feelings after the injection of the fillers, the PHILLEX line have inside lidocaine. So you remember the shadow was in this place. We have to create a very small volume upper from this line to recreate the shadow. Here we have the end of our cannula. For one half of the face, I take the decision to use one syringe of PHILLEX sub-Q, 1 and 1 cc. What you can see is that this technique is good enough because we have no hematomas and there is no bleeding, and the only one thing that we have to do is light massage and contouring to create the final result as we want. Well, next injection is the light changing of the form of the chin. One more aspiration probe. We are fixing tissue, surrounding tissue with the fingers and injecting 0.7 cc into the chin. And once more, we are making light massage to create that form that we need. And what we need is to elongate and to make a little bit more pronounced head. And the last but not least is the nose. We are trying to do this as lightly as possible. And that's all. And now we are forming very light volume. The line and the nose will be a little bit thinner. So let us see the profile. As you see, the nose starts to be better. So, and thinner. I don't think it's necessary to do it totally straight, because there are such words that the best is the enemy of the good. Super. So, let us analyze what we have on this half of the face. We have more prominent and more high skull bone. You see the difference with the previous side. We have light changes of the chin, a little bit elongated and a little bit prominent. Please look how ogi line have been changed. Skull bone goes up. And we have delicate, probably ideal nose. And now I will inject till the end of line, and after that we will see the final result.